Welcome viewers, this is Dr. Kinsuk. This is basically a name on a flower by Rabindranath, which is Palash in Bengali. It's a flower without any smell, but I am today telling you a little bit of something different about hepatitis B and hepatitis C on the eve of World Hepatitis Day. Now, World Hepatitis Day is celebrated on 28th of July every year for last more than 4 years. Now, why 28th of July is important to us? This is a day 50 years back in 1964, Dr. Bloomberg discovered the hepatitis B virus, and that's why we celebrate World Hepatitis Day on his birthday. And Dr. Bloomberg got a Nobel Prize for discovering hepatitis B virus. Is very important. And about World Hepatitis Day is that we celebrate this day so that people knows about hepatitis B as well as hepatitis C and other hepatitis virus. We take precautions so that we don't get hepatitis B and C. The transmission in the society decreases and we get vaccinated for hepatitis B. I am doing my gastroenterology and hepatology practice in this country for nearly 20 years. I'm in this profession over the last 33 years. But let me tell you, when I was starting, or I started my practice or entered the MBBS in 1981, there's not much of role or data of hepatitis B. And then subsequently the vaccine was invented for hepatitis B. And we started people getting vaccinated, and we got vaccinated in 1988-89. Hepatitis C was not invented even before 88-89, so we got that later on. And then subsequently, at the end of 80s and beginning of 90s, we got a magic drug interferon to treat both hepatitis B and hepatitis C. Hepatitis B might be invented in 1964, but it was there before the birth of human beings, that is more than 7 million years back. Then it used to infect a lot of other small animals, means its ancestors used to infect a lot of animals and cause disease or inhabit it. And then it started infecting human beings and it spread to different continents when people started migrating from one continent to the other continent. So when hepatitis B enters the human body, it enters the liver cells, causes the acute liver injury, which is called acute viral hepatitis. The person with this virus can have a nausea, vomiting, no taste to the food. Even a person who smokes does not like to smoke at that time, and all become more anorectic. She may develop jaundice in 10 to 30% cases, and subsequently in most of situations in adults, the body immunity clears the virus on its own in 95% situations. In children, newborns, the virus can go on to develop a chronic liver disease, and that happens in young individual up to 30% to 60%, and in newborn it's 90% goes to develop a chronic liver disease. In adults, fortunately, 5% of adult population cannot clear the virus from body and develop a chronic liver disease. Now, what is chronic liver disease? If the virus persists for more than 6 months in the body, it causes chronic liver disease, hepatitis, cirrhosis, and really a cancer of liver cells. Now, what is the impact of hepatitis B in this world? Is that nearly 2 billion people at some time of their life have suffered from hepatitis B. Presently 400 million people throughout the world is suffering from hepatitis B. And out of that, China has the largest population. India is number 2, it's 45 billion of Indians are suffering from hepatitis B. And if you see 100 people around in your work or any area, 4 to 5 of them are suffering from hepatitis B, which is called hepatitis B carrier. Why this virus is dangerous? Because every 45 seconds in the world, a person is dying from hepatitis B. So it has to be very important virus. See, this virus is very important than HIV, because hepatitis B spreads from one person to other person 100 times more frequently, more easily than HIV infections. We more concentrate on HIV, we should concentrate more on hepatitis B virus. Now, how does it spread? It spreads by blood mostly, from one person to other through blood contacts, blood transfusions. It can also spread through needle, that means intravenous drug addict. It can pass through sexual transmission. The most common two spreads are contact, household contacts. It's very important, staying together in the same family for a long time without physical relations. And the number 2 is from the saloon and parlors by using the common scissors, the razors, the combs, and also women wearing the earrings, the nose rings, the nail cutters also spread all this disease. So you should be very careful of that. A person who gets his hair cut in the salon can transmit the virus to the instrument of the salon, and that can be transmitted to another person who does not have a hepatitis B. So those are very important issues related to hepatitis B. The other most important issue is that when a person gets infected, they stop eating anything. Food has nothing to do with hepatitis B. Any amount of glucose, the citrus juices, the sugarcane juice does not work against hepatitis B. It does not work in jaundice. So boiled food does not work in hepatitis B. So you eat normally as soon as your appetite comes back, and you can go on, move around anywhere. There is no problem in that. And you should not be isolated in your society and can continue doing your jobs. The most important thing how to handle this virus is that initially in 1980s, a mother who is infected with hepatitis B, it become pregnant. The maternal medical termination of pregnancy would have been done, the baby would have been destroyed, or a termination of pregnancy would have been done. But nowadays we have so much of protections that we don't need that. A mother will continue the pregnancy, the child will be born, child will be vaccinated and giving intravenous immunoglobulin, and child will be protected from hepatitis B in 99% situations. So we have the most important weapon against hepatitis B, give vaccination against hepatitis B, 3 doses. As soon as the child is born, and India luckily within the 180 countries throughout the world who has universal vaccination against hepatitis B since 2011. So that means at birth you get 3 doses of vaccination at 0 age, at within 12 hours of birth, and then at 1 month and 6 months, and then become hepatitis B. There is no infection, you get protected from hepatitis B. Any adult also should be protected against hepatitis B if he or she has not taken any vaccination during his initial part, because it was not available at that time, should be protected by that. The other thing is that if the disease is there, what you should do? You should not be isolated in the society. You must be very aware. Should not stop your eating, drinking, or drinking fluids. You stop alcohol. You must keep in mind that alcohol and obesity goes hand in hand and also kills the liver along with hepatitis B. Hepatitis B, if it's required treatment, your DNA count, hepatitis B virus DNA in the blood is high. You can be treated with oral nucleoside analog like tenofovir and entecavir. Similarly, you can be treated by interferon, which is more available as PEG interferon, which is given once in a week, and the course may be anywhere between 1 year, and for hepatitis C it may be up to 1 year and 6 months, 1.5 years. More and more oral drugs are coming for hepatitis B and C, and that will be very important in next decade, that will be able to, we have already owned hepatitis C by PEG interferon and other drugs, oral drug, but it may take a little bit more time in hepatitis B, because hepatitis B stays not only in liver, it stays in other parts of the body and cannot get cleared from once a person is infected. It's very difficult to clear this virus from the body. So the main purpose of celebrating World Hepatitis Day on 20th July is this awareness. There are 2 logos or 2 tagline on this. This says hepatitis and it's closer than you think. I said out of 5, 1 is suffering from hepatitis B in this country, and out of around 1.5% do suffer with hepatitis C. Out of 100, 1.5 to 2 people are suffering in this country with hepatitis C. That's very, very important. So the next person can be hepatitis B or C. So one have to test with a simple blood test. Go for hepatitis B and C test. If you are hepatitis B, you can't take a vaccine, but if you are not, then you take a vaccine. For C, unfortunately, you don't have a vaccine till now. If a person is vaccinated, he can be treated if required. There is no role of isolation. There is no role of any food restrictions, but be loyal, don't drink alcohol, don't smoke, and have a normal lifestyle. A lot of fruits and vegetables in your diet, and be positive, so that we know hepatitis B, know hepatitis C, confront it, test it, and win the hepatitis B C virus in the long run. This is our motto on the verge of World Hepatitis Day.